you want to get started?
I think that sounds great.
Okay.
So,
I'd be looking if you'd like, if not, I can get started.
why don't you just go ahead and get started? I think you're great enough doing what you need to do.
All right, wonderful. So I'm so glad that you guys could all attend. My name's Nikki Foreman, and this is Terrell. We flew in from Dallas. Dr. Bauer and Jan and Deb invited us out to come and speak about hormones. So the good news, or well, I guess the bad news is you sounds like some of you may have some of the symptoms that are related to hormone imbalance, which is why you're here. The good news is we think that we have a solution for you. So our goal tonight is really just to tell you, educate you on the different modalities of hormones, and then what Dr. Bauer has to offer and Deb has to offer, and then see if that's really a good fit for you. So we're going to tell you what you need to know. Today, you know, in the world of the being able to use the internet, I'm sure there's lots of you that have Googled some of the different symptoms and come up and heard different things about hormones. So we'd just like to tell you some of the scientific results on hormones and then what your different options are. So hormones really are the chemical messages that give our cells and organs the proper instructions to keep us healthy. So basically, every single thing that your body does, the reason that it does it is because of testosterone, estradiol, the different hormones are actually signaling them to do so. So if you don't have the right hormones or the right balance of hormones, then your body doesn't do the things that it used to do when you were younger. So the hormones that we're going to talk about today are going to be testosterone, progesterone, estrogen, vitamin D, and thyroid. And then, by the way, since we're a little bit of a smaller group, if you have any questions throughout this, go ahead and just pop your hand up and I'll try to answer those in between. So you don't have to wait to the end to worry about that at all. So again, why do I feel the way I do? Many of you may have already had labs drawn by different practitioners and you've been told that, well, when I look at my lab slip, it says that my hormones are normal. And what I want to show you is that even though they say you're normal, really what that's telling you is that you're normal for your age. So what the labs do, or the lab companies do, is that when they pull your labs, they're going to not tell you what you actually need to have a healthy lifestyle or to feel good or to have energy or to have a great libido. They're going to say this is where we would expect you to be for your age. Now, by the way, it's not just for your age. The age bracket that they usually use is about the age of 25 to 90. So they just take the average and say, well, you're right in line where we would want to see you. So why does this actually happen? Well, as we age, naturally our hormones start to go down, but it's also because of other things that are in our environment. So drinking from water bottles, just the things that we're exposed to, the different foods, whether they're fortified with estrogen. So from our meats to dairy, all of those good things play a big role in it. So how do you feel? I'm guessing that some of you might be able to relate to this. And I'll step back a little bit, I apologize. Some of you might be able to relate to this. I think there's been a few times where this is how I felt, right? So we giggle, but it's really not that funny when we go through it. And so one of the biggest arguments that my ex-husband and I got in is because he didn't take the trash out, right? And so that's kind of what I look like. So the things that used to be not that big of a deal, all of a sudden we're now ready to get a divorce over it. So I know that some of you, and then, you know, this is another thing that we feel. Maybe everything in our life is going perfectly, but still at the end of the day, we're like, still just don't feel the same way that I did, even though my life is great. And this is how we want to feel, right? We want to age. If we're living in our society, we're living to be older and older and older, and if we're going to live to be older and older, we want to be active and happy and have a, you know, productive life. So we passed out to everyone a symptom checklist. One side is for males, one side is for females. So just go ahead and take a peek at it and see if you relate to any of those symptoms. And then some of you might be here for loved ones too. So a lot of times as we start to age, we don't really even realize it's a slow progression, so we don't really realize that those things are happening to us. So you might be able to relate to your husband or wife on some of those things. So if you are experiencing extreme fatigue, so 3 or 4 o'clock in the afternoon you hit a wall, that's related to imbalanced hormones, anxiety, depression, mood swings, tension, irritability, lack of sleep, And then also, you know, you may feel tired all the time and you fall asleep, but you can't stay asleep, so you wake up at 3, 4 in the morning. That's related to testosterone. So that was something that I had really bad. I could definitely fall asleep. I mean, by the time I got home and plunked on the couch and I was like, oh, okay, yay, I made it through the day, I'd fall asleep very quickly, but every night I was back up at 2 in the morning. It's related to testosterone. Memory loss, so you park your car, you go into the grocery store, you come back out and you can't remember where you parked your car, or you walk into the room and you're like, I can't remember why I walked in here at all. Again, testosterone related. Brain fog, just you're not as crisp and sharp on top of your game, whereas you used to be able to answer questions very quickly. Now you're like, oh yeah, that's the answer. It's just, it's not that you can't remember it, it's just that you're not, you know, quick on your feet anymore. Joint pain, weight gain, hot flashes, night sweats, bladder symptoms, migraines, decreased sex drive, and decreased performance. Those are all related to hormones. So as we start to age, that they naturally go down. And so what we're looking for is what's a really good way, what's a healthy way that we can bring them up to an optimum value. So there's different modalities that we can use. There's gels and creams and shots and pills and patches, and then there's pellets. And so I'm going to tell you a little bit about those different modalities and the pros and the cons of each one, and just kind of educate you on all of those different things. So the facts are you're considered to be in menopause 12 months after your last menstrual cycle. So I know a lot of us, when I grew up, I was, you know, I thought that you really didn't go through that hormonal thing until you actually went through menopause. And the fact of it is you start years, 10 years before that ever happens, you start to have low testosterone. So on the female side, it doesn't matter whether or not you went through menopause, you know, way, way before that, you're actually having low testosterone. Your ovaries decrease the production of testosterone and estrogen and progesterone. Your testosterone is often no longer being produced well before estrogen and progesterone are depleted. And then 100 years ago, menopause signified the end of life. So why have hormones not been that big of a deal up until as we started to age later? Well, by the time we started to really have depleted hormones, it was almost the end of our lifespan. So now that we're living well after that, of course we don't want to spend the next 30, 40 years living that way. So testosterone is very much so related to osteoporosis. So the risk increases after menopause. From the onset of menopause to age 60, women lose on an average 25% of their bone mass. So that's due to the loss of testosterone and estrogen. So for those that are, you know, have the onset of osteoporosis, osteopenia, that can be reduced, or excuse me, you can actually reverse it with testosterone and estrogen. So cardiovascular disease is the same way. The risk increases after menopause. So women are 5 times more likely to die from heart disease than breast cancer. So think about that, all the commercials and all of the benefits and all the things that you hear about for breast cancer, and cardiovascular disease is much more prevalent. Number 1 killer in women. Those who started hormones early after the onset of menopause saw a 50% reduction in cardiovascular disease. 50% just from hormones. And then discontinuation of postmenopausal HG associated with increased risk of cardiac and stroke death during the first post-treatment year. So 1 in 7 women die from heart disease. Oh, here's the other. And then for postmenopausal, so after you no longer have hormones, it's 1 in 3. So that's huge. When you do not have hormones, now you're 1 in 3 for heart disease versus 1 in 7. Women produce more testosterone in their lifetime than they do estrogen. Isn't that pretty surprising? We don't talk about that. We always think that testosterone is related to men and estrogen is related to women, but it's actually testosterone is just as big of a deal for females. Estrogen has over 400 functions in the body. Estrogen is not a female hormone, just like testosterone is not a male hormone. And then maintains vaginal blood flow and lubrication. So for those of you that sex is painful, that has a lot to do with your hormones. So if you do not have any hormones, there's not a lot of lubrication there, and then of course that makes it not a pleasurable experience. Also responsible for orgasms in women too. So as estrogen decreases, that's what's responsible for hot flashes. A hot flash is what starts in your chest and radiates up through your face, and it lasts about 45 seconds. If you have overall body heat, like night sweats, where you wake up and you're drenched all over, that's related to testosterone, and that's a night sweat. So again, vaginal dryness, mood swings, headaches, migraines, vaginal infections. So for those of you that have UTIs a lot, that's related to hormones. Joint pain, dry skin, bloating, depression, and memory lapse. All of those are related to your estrogen going down. So progesterone, it's another really, really important hormone that people forget to talk about. It's produced in the ovaries, and in menopause your level will be 0. So you're producing absolutely none of it. It's one of those that kind of has a calming effect on your body. So again, super important to your emotional wellness, but it's also very much so related to breast protection, brain protection, and a lot of other properties it has. Progesterone moderates many effects of excessive estrogen. It reduces fluid retention, bloating, headache, bleeding, and fibroids. And progesterone is synergistic to estrogen's effects on bone and lipids. So the functions of progesterone, it inhibits breast tissue overgrowth. So again, super protective to the breast. Progesterone is one of those things that if you don't have it, you can get breast tenderness. Uh-oh. You can either relate to that or I don't know. Whoa, that one grabbed her. It balances, balancing blood sugar levels, acts as a natural diuretic. So when you have water retention, progesterone is very much so, can help with that. Prevents excessive uterine lining buildup, stimulates production of new bones. So again, super, super good for your bones. Alleviates depression and reduces anxiety. For a lot of folks that have depression, it's not really depression. If you just give them a little bit of progesterone, that depression would go away. So that, for those of you that have had a menstrual cycle and that week before the menstrual cycle you feel really depressed, it's because you're having that drop in progesterone. Just a little bit of progesterone would alleviate you having those PMS symptoms, that week before. Promotes natural sleep or normal sleep patterns, normalizes blood clotting factors, prevents cyclic migraines, and restores cell oxygenation levels. So this is just a quick graph that shows that in our 20s we're, strong, and as we start to age, you can just see that your natural production of testosterone just decreases more and more and more as we start to age. So andropause. Andropause is the deficiency of testosterone. So we talked about kind of how that relates to females, and on the male side, it has some of the same things. It's just instead of people kind of tend to relate testosterone to being just about muscles, and it has so many other properties. We tend to think that it's just for those folks that go to the gym and want to have big muscles, and it has so many other effects. So it's linked to early heart disease when you have a decrease in it, common in men with diabetes, high blood pressure, sleep apnea, and other chronic disease, and it's underdiagnosed. So again, testosterone is present in both men and women. Women age 20 to 40 lose up to 50% of it per year. So females, we kind of it seems like it happens overnight because it really does. The reduction of it is just very quick. On the male side of it, they lose a little bit of it just each day, each year. So it's a much slower process. We wake up and all of a sudden we feel night and day different. And then it's like a slow progression where now all of a sudden they're just sitting on the couch, Men age 30 to 70 will lose 1 to 3% per year, and again, underdiagnosed. Decreased testosterone in women, increased risk for Alzheimer's disease, increased risk for CVD, increased risk for ORF, increased risk for DM, and possibly breast cancer. In men, increased risk for Alzheimer's, increased risk for CD, increased risk for prostate cancer, dementia, and then sarcopenia. So what are the benefits of testosterone? Here's all the reasons that you are here. I know I don't have those things, what am I actually gonna get out of this? So you're gonna start sleeping better through the night, a deeper sleep, feeling of overall well-being, reduction in body fat, stronger bones and muscles, increase in your libido, heart protection. You're gonna lower your LDL and reduce brain fog, improve erectile ability, prostate protection, cardiovascular protection, and increase in your HDL, help you build muscles, decrease that anxiety, reduce your irritability, and then your cognitive clarity, and then improve your depression. Is anyone here relating to some of these things? Did anyone just feel like that's the normal way? That's just the way that life's supposed to be? For me, my grandmother would always say, I just got sick of hearing it. Wait till you get that age. Wait till you get to be my age. That's just the way that you're supposed to age. But the reality of it is there's a lot of different things you can do to age in a much better way and a happier way.
I had a guy come into the office a while back and he said that he knew what his diagnosis was. And I said, well, what's that? And he said, it's called furniture disease. And I said, what's that? And he goes, well, my chest dropped into my drawers.
So this graph I think is pretty interesting. It shows an optimal level of testosterone, and then as your testosterone actually reduces all of the things that you're susceptible to. So a lot of times for males, they will not get checked for testosterone until they have the lack of ability to actually perform sexually. And if you look at it, they're all the way down here in the 200s before they ever get checked. So look at all of the things that they're at risk for. So what are the different methods of hormone replacement? Like I said, there's pills, patches, injectables, and then those are synthetic, but then on the bioidentical side of things, there's pills, patches, creams, gels, and then pellets. So who here has heard about the Women's Health Initiative? That trial, that study? No one? Right, and so I think that it's very interesting because the Women's Health Initiative was the thing that said hormones, it stated hormones were responsible for an increased risk in breast cancer. Well, and so you're shaking your head, you did hear about it, right? And so the reality of it is that that study did not prove that. There were a couple of different arms of the study. There was the arm of the study that was just estrogen. There was the arm of the study that was estrogen and progestin. Not progesterone that we've spoke about so far that has all of the great properties, but progestin. The arm of the study that was estrogen only actually did not show that an increase in breast cancer. It showed a decrease in it. The arm of the study that showed estrogen with a progestin, that did show an increase in breast cancer. What the media reported and what the conclusion of the study reported was not what the actual findings were. It just said an increased risk in breast cancer. And so it gave hormones this bad name. But that's not really what, the estrogen side of it showed a decreased risk in it. So,
So people understand, progestin is a prescription for a
And synthetic.
It's a synthetic progesterone, not bioidentical.
No, it's totally different.
So completely different. So all of these years that women quit, and practitioners,
Can you go back to the last slide? I just want to clarify the what by definition is that, bioidentical?
it's the same molecular, it's the same as what your body would produce.
Oh, it's a body
naturally.
producing? Okay,
Mhm.
got it.
Yep, and so on the synthetic side, the way that Big Pharma actually makes money is they'll take something that's similar to what your body produces, and then they'll add something that's different to it. That's what allows them to have the patent on it. The something that they add to it is what makes it very different than what your body usually actually produces.
That's how they make money.
That's
Oh.
how they make the money.
It usually adds more stressors to the body as it's being metabolized.
Mhm. Yep. So synthetic is, again, it's actually synthetic estrogen is derived from pregnant mare urine. So that should make you feel great. Bioidentical, again, the same, the same matches what your body produces. Synthetic can be very different. So estradiol levels better than pills, or estradiol levels better than pills, but not as good as pellets. So what pellets do is it's a subcutaneous implant in the fatty tissue, either in the flank area or in the buttock, and your body builds capillaries around it. What that means for you as a patient is that it's available to your body 24/7 versus a pill or an injectable or a gel or a cream. You have to apply it daily or sometimes twice a day, or you do the shots once a week. So your levels continue to go up and down. That's not the way your body would work normally or when you're actually producing hormones. So what the pellets do is it gives you a steady stream of the hormones to your body constantly. So patches, that's another form, and there's problems with them actually adhering to the skin. Again, the patches are changed, usually once a week. Your body fluctuates, and so you're absorbing them, but not on a consistent level. There can be some weight gain, less fluid retention than being on synthetic, because the patches do come in bioidentical, but it's an okay modality, but it's not going to be the way that your body actually produces estradiol. And 45% of folks do not absorb hormones through their skin. So that's the other thing, is your skin is meant to be a barrier, and so some folks will absorb it, but then 45% will not absorb it. So if you pulled labs pre, and then after they use the patch, you're not going to see a difference in their labs. So creams and gels, you rub it in once or twice daily. It's inconvenient. It has a very short half-life, poor absorption, and then you can transfer it to loved ones. So whether that's your pet or children or your husband or your wife, you do have transference issues. Then there's injections. Most people have heard about injections. You have a significant roller coaster effect. You usually have to give the patient a pretty high level in order for them to be able to feel any effects of it by day 3, 4, 5. So they feel really great in the beginning, but then as the week progresses, they feel less and less effect from it. And it also goes through, if there's liver toxicity from it, heart disease, it does the opposite of bioidentical, so it elevates LDLs and decreases HDLs. That's the opposite of what bioidentical hormones will do. So has the opposite effect. And then of course it always wears off before the next injection. So you'll feel great for a few days, and then the last few days of the cycle you feel really poorly. And then there's pellets. And so you can probably tell I'm a little hip on the pellets. So the pellets are bioidentical. They're derived from plants, and they have the same molecular structure as what your body would actually produce naturally. They last longer than any of the other modalities, so usually about 4 to 6 months, some people about 3 months, but in general about 4 to 6 months depending on your activity level and how quickly you metabolize them. It's the most widely studied form of natural hormone replacement. It's been around since 1939, and again, once they're placed in your body, you have a consistent level versus that up and down effect with the other modalities. The other really great thing about hormones is that, with pellets, is that it's based off of your lab work. So every person gets their individualized dose. So based off of exactly what your labs state, it's entered into a dosing site, and then that dosing site tells Deb exactly the amount of testosterone you need, if you need estradiol, what your progesterone needs to be. So it's very specific therapy versus a one-for-all. So again, it's been around since 1939, and it's the most widely studied modality out there. So it was used in Europe and Australia on women that had radical hysterectomies. So there's a ton of information out there on that. So a quick little graphic, and it shows kind of what the pellets look like. So a nice steady stream of hormones. The patches are a little bit less, But if you look at oral, it's huge spikes. That's the thing that makes you not feel well when you take it, up and down, up and down. So what Dr. Bauer did is that he went and spent a weekend in training with Vexatel, and Deb went as well to actually learn how to not just do the pellets, the actual procedure, but to learn on a molecular level how those pellets interact with your body. So it's a very specific way of doing things, and it's a very advanced way of doing things. So it's the right kind of hormone, the right dose, and then the right delivery system. So, we gotta have a little fun, right? So what questions do you have? Yeah.
How does this work if you're on a lot of medications?
Mm-hmm.
Does that go around that, work with it? Do you have to eliminate something
No,
first?
so it would be, the way that you can think of it, because that's a question that we get a lot, is if you were back in your 20s and you had to be on a medication, would they remove all your hormones from your system in order for you to take that medication? No, it's going to make things better, right? So when your hormones are at an optimal level, you may even, and again, I can be speaking out of turn because every person is very specific, and you would discuss those exact things with Deb, the exact medications that you're on. However, in general, some folks might be able to come off some medications depending on what they're actually being used for. So when your hormones are optimized, remember you're reducing inflammation and some other things in your body, and a lot of things or problems that we have are because of inflammatory responses. So Deb would do a consultation with you to discuss those specifics, because again, it's a very individualized therapy.
Yeah, and the one thing I can say is just that one of the things they taught us is that sometimes more medications can cause you to metabolize the testosterone a little faster. That's the only thing, that people use a lot of medications may need to be pelleted more often, because all the medications make their liver work more to metabolize the medications, and that also makes you metabolize the testosterone as well. So.
And then you had a question?
Yeah, earlier you had said that, was saying it was like testosterone related, does that mean it was like low, all those symptoms are because it's a low testosterone level? Okay.
When you're referring to like sleeping through the night and
Waking up or coming home and you're,
yeah. Unfortunately, yeah.
it's low level.
You don't have any of those, right?
Yeah.
What?
You don't have any of those, right?
I mean, I could fall asleep right now.
I just thought I was boring. Yes, ma'am.
You said this lasts like 4 to 6 months or so. So after that time, do you get retested and see if it changes?
So the way that the protocol works is you have your labs pulled initially, and then that's what Deb is going to look at to see all of your different levels and how much you need of each thing. And then secondary labs are going to be pulled 4 weeks in to make sure that you're within optimal range. And then labs will be pulled probably once a year, unless you're kind of going through menopause and they need to adjust things a little bit more based off of where you're at in your cycle.
And another question, if you had a hysterectomy,
Boy, that makes it much easier.
Yeah, easier, definitely.
Uh-huh.
Really?
But I'm sorry, I interrupted. What?
No,
it's-
that's good.
Yeah.
It-
Uh-huh. 'Cause- Because now for sure you're not producing any estrogen, so they can just give you an optimal value. Versus when you're starting to go through menopause, your ovaries can kind of start up a little bit and then die down and start up a little bit. So you kind of have to, it's a little bit more to manage. But if you've had a hysterectomy, then you're just not producing anything. It's not, you don't have it there.
Okay, thank you.
So expanding on her question, so what is the process? I'm a poor student, I didn't prep at all. So, where do you start, I mean, I see what the goals
You want
are.
me to
Jan,
come
do
up
you want
and-
to come up
Yeah.
and take that one?
Sure, I can try. So I'm Janet, I'm gonna be working with Deb, back doing this, and, yeah, the process, the way that it goes is, like she said, we pull your labs initially to check lab values. We also have you fill out the symptom checklist that each of you have to kind of see where you're at and get a little bit of history of how you've been feeling and what symptoms you're noticing. So then you come in and you're gonna consult with Deb to go over that, and if it shows that you are a candidate for the hormone pellets, or the therapies, then Deb will get dosing and everything for you. And then depending, soon we will be able to pellet you that same day if you want to do that. Otherwise, right now, it's about a week out after your consult that you would come back, because we have to have time to get the pellets here for you. So once you're pelleted, it's a pretty simple procedure. We do it right here in the office. It's a little tiny incision. For guys, it goes kind of in the flank area right here above your belt line. For women, it's more in the hip area, because that's where, I don't know, I have a lot of extra right there. But it goes kind of into the subcutaneous tissue. And what we do a little incision, you're numbed up so you're not feeling anything. We have some people that have been through it today and everyone's been happy so far. And it's a little metal tube that gets inserted, looks kind of like a metal straw, gets inserted underneath the skin into the subcutaneous tissue, and the pellets are fed into that skin, or into the tissue right through the tube. So it's pretty simple. Women is more simple than men. Men tend to have a few more pellets because your hormone levels need to be higher than us as women do. But it still is where you're numbed up, and really it's not a long procedure. For women, honestly, 5 minutes start to finish for the procedure. Men, maybe 10 minutes start to finish. No sutures are needed. It's a little steri strip, just like a little piece of tape that goes over the incision, and then you get a little pressure dressing on there. The pressure dressing stays on for 24 hours, and then the steri strip will come off over the next 4 to 7 days. Little bit of swelling maybe, but within a week or two, you're noticing things are getting better, and you don't care about a little bit of swelling. So does that make sense? Yes. Yeah.
What is the cost involved? Does it vary with how much, or the difference?
The amount
in
of
person?
like dosing and stuff. So the labs are $75, or no, I'm sorry, the initial labs are $150 plus a $25 lab fee, so $175 for your initial lab panel. And that's gonna cover all of your labs that we need to assess where you're at. Okay, and that's men and women, same cost, so $175 for the labs. Your initial consult with Deb is $75. And then the pellets themselves, for women, the pelleting procedure is $375. For men, the pelleting procedure is $625. Or $675, I'm sorry, I misspoke. So it's, it's...
Men require a lot more. Men require
quite a bit more
The cost is a little
hormones,
bit more.
so
And they're
the
typically
dosage
pelleted
is
less
quite a bit
frequently
higher.
than women too.
So like after, I'm sorry,
No, go ahead.
after 4 to 6 months, then does it kind of blend into
So-
your body and?
Yeah, the
go on?
pellets dissolve in your
Yeah,
system,
okay.
so you might initially feel the pellets a little bit under your
Especially the
skin.
guys.
The guys especially
Yeah.
can. But they will dissolve over time, and there's nothing left in there. Once they're dissolved, they're completely absorbed by your body, so.
And then you come back 6 months?
And then you come back and get pelleted. So for women, usually the 3 to 4 month range for pelleting. For guys, it can be anywhere from 4 to 6 months. Depends on every individual person, your activity level, your stress level, where your hormones start out at. There's lots of different factors that affect how quickly those hormones will need to be redone, so.
Is this something then, once you get it to a level, then maybe you can maintain it with other sources, or is this a lifelong thing?
Usually it's gonna be a lifelong thing, just because, I always say it's kinda like your,
Blood
what do we
pressure
say?
meds.
Like blood pressure meds. I mean, sometimes you can get off of those if you change lifestyle, but our body is not gonna start producing the hormones on its own, right? My body was already not producing them, so this isn't gonna stimulate my body to produce them on their own, so we have to continue to give the supplemental in order to keep the results
Yeah,
going.
it's kind of like just like working out. But people ask that, and I say, well, yeah, I mean, if you quit working out, you're gonna lose those results, so you can continue working out. If you decide to get off the pellets, you'll just go back to where you were.
Yeah. Yes.
So you just decide on your own, like, okay, now I'm not sleeping as well, or not feeling as well, so now I need to go back in and get
And get
checked.
help. That's a good question, like how will I know when the next time is needed, right? So what we usually say is the first symptom that you see go away or kind of lighten up, so maybe you notice that you're sleeping better all of a sudden a few days or a week after you get them. That first symptom to kind of start to get resolved is that first symptom that's gonna probably reappear. So I can speak from my own, like it was kind of the sleep issue was huge for me. So I got the pellets and within a week I was sleeping like I haven't slept in 20 years since before I had children, and the hormones started going like this, right? And then once that was about 3 months for me in, I was like, oh gosh, I'm starting to wake up again at night. So you will see those gradually return. Yeah, so what we've been doing here for the people that choose to do this is we set, for women, we're setting a follow-up appointment at 3 months for you. We'll check in with you at about 2.5 months. And just see how you're doing. If you're like, gosh, I'm still doing great, I don't think I need the pellets in a week or two, we can push that next appointment out a little bit and wait a little bit longer. If you're like, gosh, you know what, I'm already not sleeping well, yeah, I think I need them, then we've got you on the calendar and you're ready to go. So, yes.
When they re-pelletize, that always goes into that same area, or do you have-
No, you switch off areas. So we're gonna do one side and then the next time we'll do the next side. So each side has plenty of time to heal completely before you're putting more pellets in that area.
And vitamin D was mentioned as a hormone, is that in the pellet tubes things, or?
No, that's
No, that's
usually
an
an
oral
oral.
supplement.
Okay.
So the pellets are basically your testosterone and your estrogen.
Okay.
Those are the two hormones that you're gonna get in pellet form. Progesterone would be an oral supplement, and not everyone needs that, some people do. So it's definitely something, so that the $375 fee for women for pellets, that covers your testosterone and your estrogen. If you're needing progesterone or if you're needing thyroid, sometimes it shows you need that. That's additional because that's a prescription that we're gonna write for you.
And that cost, that three whatever you said, is that every time you get pelletized then?
For the pellets, so that's the pellet insertion and the procedure, so that $375. Labs are drawn, so you get the full panel initially for the $175, and then you have a follow-up panel, which is a smaller panel, and that cost is $85 for the follow-up panel, okay? And then after that, it's annual.